Hello everyone, I'm Dr. Donald John Babu. I'm a surgical oncologist, aka cancer surgeon at Reliance Hospital, New Bombay. Today we'll be discussing about cancer in general. What is cancer? What causes cancer? How can cancer be prevented? How can cancer be treated? And what can be done to prevent the side effects of the treatment of cancer? So what is cancer? The scientific definition means uncontrolled growth of abnormal cells in the body which multiply and spread to other parts of the body. Now, cancer is caused by defects in the DNA. These defects could be internal, which means there is damage to the DNA right from the time you were born. It could be a genetic problem. The other defects could be induced by some kind of toxins. For example, the poisons that one inhales during smoking. It could also be some form of poison in your food, alcohol, or any kind of substances that you consume as a daily habit. Other defects in the DNA mainly happens with age. Most defects are generally treated by the internal mechanism, which is your immune system. Now, the immune system is the policeman of the body. Any defect in the DNA is generally corrected. But with age, this immune system weakens. It's called senility, which might lead to mutations that are propagated and finally resulting in cancer. So cancer is basically an abnormal growth which is uncontrolled by the body. This growth, because it's uncontrolled, later sends out satellite tumors to other parts of the body. Now that you know the definition of cancer, let us look into the causes of cancer. Now, like I said, most cancers are caused because of the defects in the DNA. And these defects are caused maybe because of age, maybe because of inborn errors or genetic mechanisms, some kind of toxins that generally cause the defects in the DNA, or causes that are unknown. Now, with age, there are so many cancers that are generally seen at an older age group. A simple example could be a prostate cancer. In a study done on 100 males above the age of 80, an autopsy done on these 100 dead bodies revealed 9 out of 10 of these dead bodies had some form of prostate cancer. So we know prostate cancer is more a form of cancer that occurs with senility. Similarly, in the West, breast cancers, ovarian cancers are more common in the older age group, unlike India, where breast cancers are seen much in the younger age group. So age itself is one of the biggest risk factors for cancer. I know many patients who walk into the OPD asking questions to me, to God in general. Why should I get cancer? I pray to the Lord every day. I eat good food. I've avoided all vices in the world. So why me? Why me with cancer? The reason is very simple. It means the age. I recently operated an 82-year-old man with stomach cancer. He had never smoked a cigarette. He barely drank alcohol. He was very regular with his exercises. Weight was in control. He used to read every day. Yet he happened to get stomach cancer in the end. So one must remember that we all have to die of some or the other cause. One of the causes can be cancer. So age is one of the biggest risk factors for cancer, and as we know that today's generation is growing older because most of the other previous problems have been in control. For example, the infections, tuberculosis, malaria, we have very good medicines there were people who would succumb to these diseases at a younger age group. Now, as we grow older, we have these heart ailments, kidney failures with kidney transplants, very good stents in the heart, the angioplastic surgeries. These problems have been overcome. Now that we grow older, senility or age becomes the biggest risk factor for mutations of the DNA. The second cause are generally the poisons or the toxins. One must know that smoking can not only cause cancer, but it can cause other problems also. So one has to avoid smoking in general. Other than smoking, in India, chewing tobacco is a very common problem. It's a cultural issue. The Hindi heartland is one of the major consumers of tobacco in general. Tobacco has a lot of toxins that cause fibrosis of the mouth. It's not just the mouth cancer. Tobacco also causes cancers of the GI tract, the urological tract, the kidney, the bladder. Almost any organ in the body can have cancer because of tobacco. Tobacco is consumed not only via the pan, tobacco is also consumed via smoking. There are various ways of smoking tobacco in India, other than cigarettes, bidis, hookahs, etc. Other than smoking, we have alcohol. Other than alcohol, we have these fungal toxins that grow on rice, maize, stored grains. We have other toxins in the form of food that we generally do not recognize as toxins. That would be your sugar that you consume on a routine basis. In India, consuming tea at frequent intervals is a routine habit. Sugar in general increases the sugar content of your blood, which helps in the growth of cancer, and it's a conducive environment for malignancy in general. Sugar also increases your weight, the deposition of fat, which also causes cancer. Why does it cause cancer? Because fat around the body generally tends to secrete hormones, estrogen or steroids in general, which induces cancer in your body. Now, these steroids generally tend to reduce the defense mechanism. It weakens the defense mechanism, the immune system. Like I've mentioned before, it's the immune system which detects these mutations in cancer, thus prevents the cancer. Once the weight, the obesity increases, the number of steroids, the hormones that are generally generated also increases, thus causing cancer. So these are the various forms in which toxins are consumed which can cause cancer. The third that I've mentioned are the hereditary causes, the causes that you're born with. You must have often seen people walking into the OPD stating that my mother had cancer, my mother's sister had cancer. Now, this is generally because there is a certain defect in the immune mechanism. For example, the BRCA1 or the BRCA2 genes that are generally mutated in breast and ovarian cancer patients. They are part of the immune system. The immune system, like I said, weakens, mutations go undetected, and the result is cancer. So the causes that I have mentioned are generally the toxins, senility, and hereditary. Now, coming back to an important topic as to how to prevent them. Now, like I said, age cannot be prevented. As you grow older, you tend to get some kind of disease. What you can prevent are other health problems like Obesity causing heart problems, obesity causing diabetes, obesity causing hypertension. How do you avoid obesity? All that you have got to do is have good sleep, daily exercise, controlled food and diet. And these three, for your information, is free of cost. You do not need to go to a doctor. You don't need to pay for good sleep or to have 1 hour of good exercise. Your diet needs to be controlled. You need to control yourself while you're consuming sweets, sugar, fast food, etc. Meat that you consume should be balanced. It should be once or twice a week and not on a daily basis. Meat in general have steroids. Meat in general have fatty content, which can also increase obesity, and thus your diet needs to be controlled. So 3 very simple things that you could do: good sleep, daily exercise, and controlled diet. Once you are above the age of 50, I would also add a regular annual health checkup with your physician or your doctor. A health checkup could include your routine blood investigations, a sonography of the abdomen, a simple chest x-ray, and if specifically related to cancer, a few tumor markers and blood markers. A lady above the age of 50 needs to do a mammogram on an annual basis, a cervical pap smear done once every 3 years, a few tumor markers like CA125, which can detect ovarian cancer, CA19.9, which also detects ovarian cancer, colon cancer, CEA related to a few GI cancers, liver cancers, and also the colonic malignancies. One should also do a chest x-ray to detect malignancies in the lungs, a urine for cytology for malignancy in the bladder or kidney. A sonography of the abdomen will detect any tumor in the abdomen. A sputum cytology will help you detect tumors in the lung. So this is a comprehensive annual checkup that you can do every year pertaining to a single organ. Another one that I would include is a stool sample for occult blood, because colonic malignancies generally bleed, which can be detected by a simple test. So these are the simple preventive mechanisms and the screening mechanisms which might detect cancer at an early age, because we believe that cancers at an early age are 100% curable. Now, once you detect cancer, what kind of treatment can be given to you? Now, in general, we have 3 modalities of treatment: surgical, medical or chemotherapy, and radiation. To medical oncology, you can add a few subsets like hormonal therapy, immunotherapy, which are quite in vogue nowadays, and some form of tablet therapy, which is just like chemotherapy, but these are tablets that you just pop in. In surgery, we have certain advanced form of treatments other than these open surgeries like laser, laparoscopy, robotic surgery. One must remember that whether it's open, laser, laparoscopy or robotic, these are means to an end, and the end is to get a good oncological outcome. If cost doesn't permit, one doesn't have to insist on a certain modality of treatment. As far as radiation is concerned, we have got very advanced form of radiations. These advanced form of radiations prevent a lot of complications that arise from radiation, like dryness of mouth, dryness around your perineum, itching around the perineum, discoloration of the skin, and a lot of other radiation related ailments like vomiting, getting weak, etc. Medical oncology, at our hospital, we do have chemo caps that prevent loss of hair. One has to wear the chemo caps while the chemotherapy is being delivered. The scalp gets cooling, hence prevents the hair fall. Other side effects of chemotherapy might include diarrhea, vomiting. These are best explained by the treating physician. Under medical oncology, we also have other treatments like hormonal therapy, generally given for gynecological malignancies or breast malignancies. You have immunotherapy, which are in vogue. Immunotherapy is basically targeted therapy where we induce the immune system to work in a certain way against these malignancies. And then there are certain tablets that you consume. These are small doses of simple medicines that prevent the growth of cells. So to sum it up, I have already mentioned what is cancer, what causes cancer, what are the simple ways in which you can lengthen your lifespan, what are the simple ways where you can prevent cancer, how do you screen cancer, what are the modalities of treatment, and what are the side effects and how to prevent them. I hope all of you take my advice seriously. Till my next video, take care. Bye-bye.